Hello everyone, welcome to Functional Nurse Academy Graduate Feature. For more information about Functional Nurse Academy, be sure to go to functionalnurseacademy.com. And here's your host, Nurse Melissa.
Welcome to the Functional Nurse Academy Graduate Feature. During this show, I love to spotlight the incredible journey of nurses who have transformed the way that they practice and also their mindset through the lens of functional medicine. My name is Melissa Schreidfatter, and I am the founder of the Functional Nurse Academy and Christian Functional Medicine Academy. In today's episode, I'm going to be sitting down with one of our amazing graduates and hear how she is using functional medicine and using her own independent business to change lives and redefine what it means to be a nurse in today's world.
I have a topic and a guest today that I think is just going to be able to help so many people because, as we all know, America, we talk about this a lot, that America is struggling with a chronic disease crisis, and we've never seen children this sick before. So I am so honored to be joined today by one of the Functional Nurse Academy graduates. Her name is Danielle Friend, and she is specializing in complex pediatric cases, which is what we so need right now. She is a master prepared registered nurse, board certified functional wellness practitioner, and she specializes in conditions such as PANS, PANDAS, ADHD, autoimmune disorders, chronic inflammation, metabolic dysfunction, so many areas of expertise. And she is the founder of Friend Functional Wellness. She blends advanced functional testing with holistic protocols and practical education to support families who feel stuck, dismissed, or overwhelmed by traditional medicine. Her work is deeply personal, rooted in her journey as a mother to multiple children with autoimmune conditions, brain inflammation, chronic health challenges. And she is very passionate in this area. Welcome, Danielle. So great to have you here.
Oh, thank you, Melissa, for having me. I'm excited to be here.
Yes, I get asked frequently about referrals for functional nurses that are specializing in pediatrics because, as you know, all of these pediatric conditions, especially the neuropsychiatric conditions, these families are not being served well in the system. So I'm so glad that you have really used your experience to take up this work. But I did want to ask you, because I know a lot of our listeners are wondering, what exactly is this neuroinflammation that we're hearing about?
Well, neuroinflammation is when the brain is triggered by an activated immune system and it causes the brain to be inflamed. And so a lot of times people think that it could be like a mental illness or like a psychological imbalance, but truly it's just the immune system creating chaos in the brain and the signaling pathways. And then it's a physiological process that kind of sometimes look like bad behavior in kids.
Yes. And, I remember when I was a kid, and again, I'm like, I don't want to reveal my age, but maybe I will. But anyway, when I was born in the 80s, the mid 80s, and I do know that there is a factor of we are diagnosing more, but we know that this explosion of these behavioral disorders and other chronic disorders in children, it has significantly increased. It's not just being diagnosed more. But I wanted to ask you, so what do you think is causing all of this?
So I think it's a variety of different things. There is some predisposed genetic kids that are predisposed to developing these conditions. There's some genetic triggers that, may or may not manifest in children depending on, how their life goes. There's also, I believe it's, there's always the big debate against, is it nature versus nurture? And I kind of always say that it's both, because like I said, you have the opportunity for things to get expressed that may develop. And then what triggers that is, do you have some kind of virus that may bring it out in kids or even in adults? Do you have some kind of mold or mycotoxin exposure, which is interesting because a lot of people don't even realize that that's a thing. It's like an invisible thing that can affect children. And it sends them into, like they may have anxiety, they may feel like they have OCD, even some autism spectrum symptoms can be traced back to mold and mycotoxins. So a mycotoxin is actually like the toxin that is released by the mold, and then it disrupts the nervous system. So other infections like Lyme disease, Bartonella and Babesia, people get bit by a tick, or they know it or they don't know it sometimes, and it can be a silent infection that crosses the blood-brain barrier and causes all kinds of symptoms in kids. A big one that is really overlooked is leaky gut or gut imbalances. And so this is one of the major causes in terms of children that is really not explored in the traditional medical realm. And they can develop food sensitivities if they have a leaky gut. So one day they might be eating a banana and they're perfectly fine. And then the next day, now they've all of a sudden got some kind of sensitivity, and, they're reacting to different foods. And, they could go on and develop something we call mast cell activation syndrome, which is when your body just starts to get overloaded and will respond to everything. Some kids can even respond to, certain sounds and lights and touch. It's just, their body gets so stressed that it stays in this fight or flight. So really actually in the fight, they weren't always on the guard to fight because they're being bombarded by things in pollution and, microplastics and all the other things, environmental toxins. So, and one thing that we really don't even kind of consider is like trauma. There's a lot of research coming about how trauma affects you and affects kids. And when you have especially long-term childhood trauma, it can pair up with your physiological symptoms you're having. And then now your neurosystem is just really inflamed and it just doesn't calm down ever. So you start seeing these behavioral things in kids, and it's interesting because in an adult you might see some brain fog, some chronic fatigue, low motivation, a little bit of irritability. But once you start seeing it in a kid, it's changes completely. You get all kinds of different symptoms that are overlooked and just like dismissed as behavior.
And it really is, it's so multifactorial, guys. And I love that you mentioned mold. And I'm like so many of the things that you mentioned, mold, Lyme disease, mast cell activation. I'm like, oh yeah, I had all of those things, but these are real conditions that people are affected by. But again, we understand as functional medicine nurses that there is on average a 17-year time lag between when we discover something in the scientific literature to when that actually can get implemented into the standard of care and things like that. And I was so excited when I saw this published case study of a little boy who was in remission from all of his autism symptoms after he was treated for mycotoxins. We know that with the studies of epigenetics, if you ever are going to a provider and the provider's like, oh, it's just genetic, you can't do anything about it. Not true. So we have studied this extensively. We know that genetics are about 25%. There may be a genetic susceptibility, but something must turn on that genetic factor. The genetics are the gun, the environment is the trigger. So we know over 75% of these chronic disease processes are environmental. And unfortunately, this is why these families are just suffering so much, because our conventional system is not set up to address root causes. So could you tell me, and I think that this is, when I saw what you were doing, so Danielle posted in the Functional Nurse Academy Facebook group where you put together this like wonderful flyer explaining exactly what you do and how you're able to help work in collaboration with healthcare providers and your specialties. And I was like, oh, I've got to have you on the show because so many people need this service and it's going to help so many families. But can you tell us a little bit about with these severe behavioral disorders or the neuropsychiatric and things like that going on with children, what is the go-to standard of care? For an example, something like ADHD or PANS, like how would those conditions usually be addressed in the conventional system?
So I was as I was listening to you speak about how long it takes to get traditional medicine to recognize certain things and start treating them appropriately. It makes me think of my son. I have a 33-year-old son who was diagnosed as ADHD, then having anxiety, then bipolar, all by the age of 9. And he was actually sent to a behavioral psych ward because he was talking about killing himself, and he was very distressed and destructive and angry, and we never really could figure out what was going on with him, because it's not like his environment was something that would provoke these things. And so the go-to then, and actually still is the go-to now, all of these years later, is to put them on psychiatric medications and give them medicines for ADHD, and have them go to therapy, and tell the parents they need to discipline more and they have to have more boundaries, and and even if the same with PANS, and unfortunately PANDAS and PANS are not even hardly recognized in your major healthcare systems. When my daughter was hospitalized and I mentioned PANDAS, she was diagnosed with PANDAS, they told me that's not real. And this was just like 3 years ago, and there's so much research that shows that it is real. And I was really kind of hoping that, one of the side effects of COVID may being that people are seeing that, COVID has triggered long COVID, that they would start to realize that other infections also are being triggered in children, and that the research would start to, catch up to where we are in terms of, seeing that it's a holistic problem and it even affects kids. But it seems like they just kind of push it off to behavioral or parenting or something they can fix with medications, which is not always the case.
Yeah. And what just irks me so much is, and with children, oh my goodness, like seeing a suffering child, especially with these issues that are so misunderstood, is that the medical system is treating these symptoms of the neuroinflammation. I cannot tell you how many times I have seen this, where and I would never shame a parent for using a medication therapy, because again, there may be a time and place for certain things, risk versus benefit analysis and whatnot. But I see so many of these pediatricians and other physicians go straight to prescribing a drug, and there's no conversation about the gut health, your micronutrient status. They don't even recognize that there's neuroinflammation, and there's so much research out there. And again, I think so many of these parents, they're so overwhelmed. They don't know what to do. They may have limited resources, but then also, what the dietary intake is also really important, when we have these foods that are really high in processed food intake, high in synthetic chemicals, petroleum-based food dyes, and all these other things. These are all things that further increase inflammation. And I also, it also reminds me so much of what I went through with Lyme disease, which and I thank the Lord all the time for this, because I'm healed from this to the point where I was like, yeah, let's have back-to-back babies. It's fine, and I think back to how miserable I felt. And I know that people that have this condition, it's the same type of gaslighting for these families with, PANS and PANDAS, where so much of the medical community doesn't recognize it's a real thing. So people go without treatment and suffer. And I also know I have a lot of people that are probably thinking, what is PANS and PANDAS? So what does that stand for? And what are the symptoms associated with that?
Okay, so PANDAS PANS is pediatric acute neuropsychiatric onset of the inflammation. And so if you say PANDAS, then that is just because it was triggered by a strep infection. So, and so many kids get strep, my daughter had strep so many times, and then sometimes we were even told, oh, she doesn't have strep because her throat's not sore and she doesn't, and then she ended up getting scarlet fever and, multiple things down the road. So PANDAS is just something that is triggered by strep infection. And then it causes a sudden onset of OCD. You can have rage, some food restrictions, developmental regression. I remember when this kind of started happening with my daughter severely. So a little bit about, my son being diagnosed originally with some bipolar ADHD, and so all his life growing up, he we've looked at it as like a mental health condition, because mental health really hasn't gotten a look at a functional aspect until recently in, functional medicine. And so he's been on multiple medications and things. So when my daughter first looked like she was starting to have symptoms, the first thing I thought was, she's got bipolar. It's the same thing that's happened to my son, and so I took her to counseling and I, took her to multiple doctors and they started her on anxiety medication, and she's like 5 and 6 years old, and at the time I didn't know any better because I had a son that was going through the same thing. And I wasn't in the medical field at the time. And I was just one of those parents that was, thought the doctor knew everything that they, said they knew. And I just blindly followed the doctors and everything. So, but she kept having other symptoms, and I just kept taking her back to the doctor and taking her back to the doctor. And they would just be like, oh, she has, seasonal allergies, and oh, she has, different things. And actually she was born with sepsis. So I really kind of think it started there, and it just kind of progressed as our years went by, and one of the things that is a little bit about PANDAS is, and I think that they're going to be changing the criteria for it in PANS is, they say it's a sudden onset, but we're seeing a lot more kids that it's not really a sudden onset, it's a gradual onset. So you may have been experiencing mild symptoms that have gotten worse over the years of your child's life versus the child that just wakes up one day and they're like a completely different child. And you're like, who is this? And you don't know what's going on. So those are two different ways that it can present, so I think sometimes that maybe people don't look at it because it wasn't a sudden, acute onset. So, but I think that they're going to be changing that, shortly in the definition of it. So, but when it got really bad was my daughter started having seizures, and we were in the hospital. She was hospitalized 6 times 1 year with like 25 visits to the ER, and we had no idea what was going on. And that was when I started to think like something else was going on, and they're just not fixing it. She's on 8 different medications. Nothing's helping. I need to do something different,
Oh my goodness, bless you. I cannot imagine having a child that is having seizures and is needing to be on so many different medications. And another thing that I wanted to mention about, because we do know that things like strep can, trigger PANDAS and, other infections and things like that can trigger these neuropsychiatric issues. But again, one of the things at the root of this is having a healthy immune system. And, what we're seeing and what we recognize in functional medicine is there is so much immune dysregulation, guys. And I also talk about with functional medicine to simplify. Why are people so sick? Okay. And it's just to make it simple, crap food, stress, and toxins. And again, with things like toxic exposure, we talked about the mycotoxins earlier. Heavy metals are also an issue. It's really important that we are assessing what goes into the body and we are assessing the health of our environment. But there's a lot of things that people just aren't naturally looking at, but a dysregulated immune system cannot handle things like a strep infection. A dysregulated immune system can start having autoimmune activation and reactivation of Lyme disease and things like that. So there's so many things to look into with that. And then there's also a lot of ways that we can holistically support the body. And I did want to ask you, I feel like you kind of went through the boot camp of all of these pediatric issues. So when you were going through the system as a mom and your children are suffering, did they ever recommend any like holistic based strategies, or was it mainly like therapy, medications, things like that?
It was medications and therapy. And even a doctor one time when my daughter was hospitalized, recommended that she be admitted to the behavioral health unit because he thought it was all psychological. And I was like, well, then we're leaving because I know this isn't psychological and that isn't going to help us. So we ended up, leaving at the time. Now, I do want to say that there are times when, medications, as you mentioned, are necessary. Like if your child is in crisis and suicidal and self-harming, those are times when you're going to look at, your medical community to help you to control those symptoms because they could be detrimental to your child's health in, the acute condition. But then in the long term, look and see like what's causing that. So nobody ever recommended anything for me. I started thinking, back, I have a 30-year-old who was diagnosed with celiac disease when she was 2. And that was a long time ago before celiac was a thing. So I kind of feel like in my life that like God has put people and things in my path that have helped me to move forward and figure out what was going on to maybe prepare me for where I am today. Because, my son, you mentioned back, heavy metals and things. He was diagnosed when he was like 3 with lead toxicity. We were living in a house that had paint and, that was causing him to have lead issues, which probably contributed to, his mental health down the road, which, I was young at that time. I didn't know anything and doctors didn't know anything. And then when my other daughter was born around 1.5 to 2, she was, constantly vomiting, having an explosive diarrhea, couldn't keep anything down, not growing, failure to thrive. And I met a girl who was the wife to a coworker of my husband who told me about celiac. And I started looking into it and I was like, you know what, this sounds like it could be this, So I took her to the doctor and we had at the time it was, you had to have a biopsy, go off of gluten for 6 months, have another biopsy, go back on gluten for 6 months. They didn't have the test that they have now for celiac disease. And so it was a long drawn out process. So what I did was just remove all of gluten, anything gluten in her diet. And then she was fine. Like all her symptoms went away. She started growing. Life was great, and they had wanted us to come back and do like another biopsy. And I was like, well, I don't want to put her under for something that I know is working. Obviously it's the diet, so she went on to be a healthy, happy, productive, individual. And so then when my daughter started having all of these seizures and I started doing my own research because nothing was helping us. And we even had a neurologist who kind of just dropped us mid flare because he was like, you're too complicated and I can't help you anymore. And then I'm like, well, what am I supposed to do? I can't take care of this. I don't know what's happening. So I went to like a larger hospital, but that was the one that told me they didn't believe in PANDAS. But we did see some of their physicians there. And I just said to the doctor, you know what? I have found in the literature the connection between seizures and gluten and celiac. And an average it taking about 7 years to realize the connection when people were having seizures that they did have celiac. And I already have a daughter that I know has celiac, confirmed. I'm taking the gluten out of the diet. And he was like, whatever, go ahead. That's fine. Not that it's going to do anything because it's psychological, and lo and behold, my girl was having seizures 3 or 4 times a day. And the first 2 weeks we went off of gluten, she was having seizures once a day, then once a week. And then I went on and did some further testing. And I'm like, okay, obviously she's got an issue with gluten. Is there anything else that's affecting her? We did some food sensitivity testing and we found out she was highly allergic to corn and citric acid. Corn and citric acid are in everything, so taking that out of the diet was not as easy as I thought it was going to be. Because at the time I was like, oh, we don't eat a lot of corn. So we have some tacos every once in a while, but no, corn is in everything. And so we took that out of the diet. Her seizures completely stopped. She was having episodes of syncope, just passing out randomly. They in the hospital, they're like, it's part of whatever's going on with her mentally. And I did not believe that. So I continued to take her to the cardiologist who, had diagnosed her with POTS, which is postural orthostatic tachycardia syndrome. So every time she would stand up, her heart rate would go super fast. And then it would just drop down really slow. So kind of like when you're exercising, how your heart rate gradually goes up as you're exercising and then it gradually comes down when you're done exercising. Well, it would just shoot up and shoot down and that would cause her to pass out. And so we figured out that we could control that without medication, but we increased her electrolytes, increased her water intake, made sure she had enough salt, controlled it through diet. So all of these things, her mast cell, she was diagnosed with mast cell activation syndrome. That came under control when we started taking the things that she was sensitive out of the diet, removing them from her environment, going to the more holistic facial products. And, because people don't really think, especially with kids, they have all these cute little paints and things they can put on their skin and, tattoos and all the fun things. That's great when you're a kid to do, but that gets into your skin, which is your largest organ, gets into your system and can cause, dysregulation in the system. So once we started making all of these changes, none of which were supported by the traditional medical system, we saw an improvement.
And it makes sense too, because, when you are highly sensitive to certain foods, and again, I could do a whole show on gluten. Guys, the gluten we are eating today, it is not the same gluten that Jesus was eating. It has been super hybridized, and then they are spraying it heavily with glyphosate, and that also is another show. But when you are eating things that you are highly sensitive or allergic to, that's going to cause a significant gut disruption. It's going to cause significant leaky gut, which is going to then further activate your immune response and then inhibit your body's ability to properly absorb nutrients and minerals. And, just thinking about these things, it seems like common sense, right? Like when we're struggling with something, what are we putting in the body, And it is so frustrating to me that the conventional medical model is this far behind. I mean, they really don't even know to tell patients to filter their water. I mean, it is so unbelievable. But there are a lot of changes that parents can make at home. And even if you don't have any type of medical degree or background in healthcare, there's so much we can do as parents to help our children. And also that intuitive feeling when you know that the doctor is not right. God gives us that intuition. It's like that mommy intuition when we just have that inner knowing. And I remember I was actually a psych nurse for several years. This drove me crazy when the physicians, because I would also do psychiatric consults in the medical center, when the physicians cannot find something wrong with someone medically, or if they don't know, they are then like, it's in your head, it's a psych issue, go to psych. And I remember we had a patient who was hospitalized because he had recurring vomiting. They couldn't figure it out. Again, they probably weren't doing the correct testing or didn't have the test available. But they went and told this patient it was in his head and go to psych. And I'm like, how? It doesn't even make any logical sense. But anyway, it is about time to cut for break. And when we come back from break, we're going to talk more about where functional medicine comes in and strategies that can really help. I will see you on the other side of the break. If you are a nurse that is fed up with the sick care model, I have a solution for you. My name is Melissa Schreibfetter, and I am the owner and founder of the Functional Nurse Academy. FNA is the most comprehensive functional medicine training program on the market, specifically tailored to nurses. It is self-paced and equips LPNs, RNs, and nurse practitioners to practice functional medicine, address the root causes of dysfunction, and start their independent functional medicine practices. At FNA, you will learn how to order labs, functional health reports, create customized wellness plans, package and price your services, and even how to market your brand effectively. Graduates earn 90 nursing CEUs, and then they qualify for multiple board certification titles. They also will have access to our exclusive tools, such as our Functional Nurse Toolkit, our social media and marketing kit. And I don't want to just train you and send you on your way. So you also will get access to me each month via the Functional Nurse Academy monthly mentorship program, where you will be able to attend a live class with me each month. So say goodbye to sick care and start your dream career as a functional medicine nurse. Enroll today at functionalnurseacademy.com. Hello and welcome back to Nurses Out Loud on America Out Loud Talk Radio. This is your show host, Melissa Schreibfetter, and I am joined today by one of my Functional Nurse Academy graduates, Danielle Friend, who is extremely experienced, master prepared nurse. She's also board certified in functional medicine and is the founder of Friend Functional Wellness, where she is doing God's work in this world, and she is helping pediatric patients with complex conditions. Welcome back, Danielle.
Thank you.
Well, I am so excited to go over this topic today because I really do think that there are so many families that are going to benefit from this information. And again, like we were talking before about how there's just not a lot of help in the conventional medical model, and people need to seek out other resources and other services. And I do think, you know, we talked a little bit about the silver lining of COVID. I'm like, this is totally a silver lining of COVID as people are starting to see, okay, a lot of things don't make sense in that system. What is this thing about functional medicine? Whereas I feel like pre-COVID, a lot of people didn't really know what functional medicine is. And now like everyone knows what it is. So can you tell us, I know we were just chatting about how helpful diet can be and you reducing toxic burden, but what are some other just like functional wellness strategies that can help in these cases?
So I do want to mention something before I forget, because I was thinking about it at the break, that I want parents to know that just because their child doesn't have like severe features of, neuroinflammation, kind of like my daughter had, the seizures and the fainting and the, other things like that. But if their kids are experiencing like anxiety that doesn't go away, some kind of they're chronically anxious, they feel overwhelmed all the time, maybe they're struggling to sleep or to focus, or they're having sensitivities. My daughter started out with this little bit of sensitivity to some clothing and, sensitivity to some sounds and light, things like that, that their child could still be suffering from, brain inflammation. And it doesn't always become as extreme as my daughter had. And so I don't want anybody to think, oh, that's not my child because, my daughter was such a extreme complex case, for this. So I just wanted to make sure everybody knows that there are other things that it doesn't have to be so extreme, So other things that we can focus on, other than diet, is like, well, we talk about sleep. A lot of these kids have issues, with their sleeping. So sometimes it's really hard. I have found that sleep is one of the hardest things to fix in these kids because the immune system is so active, especially at night when they sit down to go to sleep and the histamines pop up and everything's going on and their mind starts racing and stuff. So just kind of like trying to get together, they say sleep hygiene, which would be kind of hard with these kids, but a routine that kind of gets the kids ready for sleep, maybe we have done a lot of baths in the night that we use Epsom salts with, which is great to help the little bodies detox, at night. So we do an Epsom salt bath. We also use a magnesium lotion because that can help you to relax. And a lot of people, especially kids, are deficient in magnesium, so we use magnesium lotion. We try to put the lights down rather early, kind of around the sunset. And I actually have purchased some light bulbs in the house that are like, they mimic your circadian rhythm. So to kind of help us get in the mood to go to sleep and stuff, because, prior to this, my daughter would be going to sleep at 2 or 3 in the morning, and then she wouldn't stay asleep, so a lot of these things kind of calmed down when we started treating things like she was very deficient in minerals and vitamins because she had restrictive eating, which they just said was anxiety. And she had sensory issues, so she didn't eat a lot of different things. So she was missing a lot of nutrients that her body needed. So we did some functional testing to find out what she was missing so that we could target those areas so that she's now getting the nutrition that she needs. And, a lot of people don't realize that your vitamins and your minerals, they also affect your mood and your hormones and everything. So if you're lacking them, then it's going to be expressed in these also in these ways that could be considered behavioral problems, in kids. So something as easy as taking a multivitamin can be, work well for these kids unless you don't know exactly what, you're dealing with, but everybody's lacking some type of nutrients.
Yes. And guys, everything is so it is so interconnected, guys. And this is one thing I like to tell my students. Like when you're working with a case, you will never be able to identify every little thing that is going wrong. But one of the biggest things is focusing on those foundations of wellness. Our body heals when we are sleeping. If your nervous system is too upregulated to sleep, you do want to start looking at environmental things and also nutrients and minerals, because things like melatonin, that is a potent antioxidant, also helps you sleep. There are nutrient and mineral precursors to these things. And a lot of times we see these kids that they go through puberty and they do not do well with these hormonal transitions, and they start having all of these mood disorders and other hormonal issues. Well, nutrients and minerals are precursors to your hormones, and then also our amazing detoxification pathways. I feel like detox has become kind of like a buzzword, because it is correct that there are people out there trying to sell detox crap. However, there are massive detoxification impairments due to nutrient mineral deficiencies, genetic variations, infections. We know that like infections like Lyme disease can slow down your detoxification processes, and then toxins in general can slow down your detox processes. And one of the most common nutrient deficiencies, I'm so glad you brought up magnesium. Magnesium is an essential mineral. Magnesium is not in our crops like it used to be, because we are no longer remineralizing the soils. I mean, my grandparents lived on a farm and they were eating off of the vine. They were eating fresh food. We're not really eating like that anymore. I mean, even if you are eating an organic diet, which is so expensive right now, when you go to the local health food store, those crops, those foods have been on the shelf for a long time, and they lose more of their, nutrient and mineral quality the longer since they've been harvested. There's so many different factors. And again, some of these interventions that you're mentioning are like simple interventions. I mean, getting a high quality mineral and a high quality multivitamin. And then I like that you mentioned the light bulbs, because again, if we just go back to common sense, okay, I know so many families, everyone is busy. And then all of this access to electronics, it's not good for us, guys. It constantly upregulates the nervous system. And in nature, when the sun goes down, they're signaling to our circadian rhythm. The sun is going down, okay? Start ramping up production of melatonin so you can go to sleep. But what happens when you are just surrounded by all of this artificial blue light and all of these screens in your home? And then you can't sleep. I wanted to ask you, Danielle, have you seen this, where these kids, we see this in adults too, right? Where they can't sleep at night, and then they're being prescribed habit-forming sleep aids, and no one is assessing what's going on with the circadian rhythm.
Oh, yes. I have seen that over and over again. And I have actually experienced that with my own daughter, trying to put her on sleeping meds at age 6. 7, 8, 9 and stuff. So we did at one point supplement with melatonin when she wasn't able to sleep, but at least it was a natural, supplementation, for her. So, and I do find a lot of these kids that are in these flare states, when they're really up-regulated, they spend a lot of time on their iPads and their computers and their things. And I noticed that when my daughter was going through the most severe case of that. But as she got better, she spent less time on those things. Like, they weren't her constant focus. I could see, it was really interesting because it was like during the 5-year period of crisis that we were in, she missed out on a lot of childhood. And when she started to get better, I could see little glimpses of that little girl coming back, where she wanted to play with dolls, even though she was a little bit older to be playing with dolls. She had missed that part of her childhood. She got really super into art, and the most interesting thing I saw, and we had been in one of our hospitalizations before we figured out what was going on, and she would paint. She loved to paint. So she painted this crazy, chaotic, masterpiece of just mixed colors and whatever, and then the next day it got a little bit better. There was kind of some shapes and some figures and things. And then the third day, by the time her brain had calmed down, because she was in a seizure process at that time. She did a unicorn with a rainbow, and it was like, and to see like that was the most defining look at brain inflammation that I could see produced by a child, to go in 3 days from just crazy chaos to this beautiful picture, masterpiece, just was a reflection of what's going on in their crazy little brains, when they're, just being so overwhelmed. So another thing that we also like to do, and that I recommend to a lot of parents, is trying to bring down the sympathetic nervous system and put him to parasympathetic. We like to do like just rebounding, jumping on the little trampoline. That's helpful for toxic drainage and to recalibrate your nervous system. We have a vibration plate that we use that some of the kids really like, and that helps also with drainage and bringing their parasympathetic nervous system, back into alignment. So there's all kind of just like little things that you can do. Singing, little kids love. No wonder my daughter loved to sing. It brings her, her sympathetic nervous system down. And then another thing, and this is like so interesting because we don't really see a lot of this anymore, but one of the things that you see in like kids with autism is like the shaking and the rocking and the, and that actually is calming to the nervous system. So to me, that tells me that something is going on, that their brain and their nervous system need to calm down. So why is that? What is triggering this up regulation in their brain and their nervous system, and what can we do about it, rather than just say, oh, that's normal for someone who has autism. Like at the time I had my daughter evaluated for autism because I just did not know what was going on, and the girl told me, but she had already received a PANDAS diagnosis. Like we'd been to a specialist who at that time recognized it and whatever, but she is like, okay, well, yeah, she could have autism, but it could just be all the symptoms from PANS and PANDAS. And she's like, so do you want me to say she's autistic? And I was like, no, I want to work on whatever the cause is. I don't want you to say she's autistic, So we did find some practitioners that were willing to try to help us with kind of mixing traditional medicines like IVIG, antibiotics and things. For PANDAS, treatment is usually long-term antibiotics and like IVIG therapy. But she also wanted to try to include, some detoxification products and some vitamins and supplements. But it was just so overwhelming that we didn't know where to start or how to follow up and who, and then we were never seen for like 6 weeks and we couldn't get a hold of the office. And so it was really hard to implement those things when nobody was there to guide us. It was just like, here you go, here's your stuff, move on. So that's really one of the things that I'm trying to do by pairing up with physicians' offices, is to be able to help them implement, the holistic approach that they want to also include with their traditional treatments as well.
Yeah, I really love that. And, I think that there's so much that registered nurses can do in the area of functional medicine. And I remember when I was really sick myself, that was like a huge, huge obstacle is, you may get a diagnosis from a functional provider and they may tell you what to do, but then you go home and you don't know how to do it and you don't have any support. And nurses are so good at that. So and we can really fill in the gaps there, because again, the number one reason why people are not successful with functional medicine plans and programs is the provider is giving them way too much to do too fast, and they're not getting support, and nurses can come in and really fill in those areas. And then we also have the capability to run testing and can use that data to collaborate with the healthcare team. So now I did want to ask you, since, we're going to be featuring you for FNA this month. I like to feature a graduate every month and the wonderful work that they're doing. Would love to hear from you about your experience with FNA.
So I really enjoyed FNA. It was my first, was when I decided I wanted to go on and be able to pull all of my knowledge together and use it to help families like mine. Then I found your program. I had looked at all kinds of different other programs, and yours just kind of spoke to me. So I signed up for it. I really love the fact that I could work at my own pace, because I'm like a go-getter and I'm just like, let's learn, let's do, let's whatever. And then the caseloads, the case geez, I have a brain fart.
Case studies.
Thank you. The case studies that we do, they're great. I mean, I learned so many things, and I was constantly taking notes, and I was like, oh my gosh, I never really realized that. And I was able to start taking, like, because I'd been a nurse for a long time, prior to even getting into this space, and I always felt like I was kind of like struggling between meshing the two together, and so taking your course was able to give me like the clinical depth and mentorship that I needed to pull them both together and to see that, think in more of a root cause way before of like, let's just fix the problem, like to go more beyond the why. I feel like in regular nursing, like we never ask why this happened. We just like, this is happening, let's fix it by doing this, so being, going through your course and learning so much about, the gut system and the different thing, and then how to take all that information and put it into a plan that's going to help somebody, was just amazing. I really enjoyed it. I learned so much.
Oh, I'm so glad. Yeah. And I don't think I would have even ever been able to put something like that together if I had not been so sick myself for years because I think that when you go through chronic illness yourself and then you go through the system going through conventional and functional, it really opens your eyes to a lot of things that are being done incorrectly. But then you also see things that are done correctly, and you can kind of incorporate those things to help other people. And well, I'm so excited that you have started your business. So now tell me, so it's Friend Functional Wellness.
Yeah.
Before we started the show, I was like, your name is so much easier than Schreibfetter. I would love to incorporate my last name into my business, but I can't for obvious reasons. But so tell me about your practice. Now, are you seeing clients out of state or just where you live? How does that work?
No, I am seeing clients out of state, and I do everything virtually. And you can find me at www.daniellefriend.com, nice and easy. My practice has been open for almost 2 years now, but I've been learning and, incorporating all these things for a much longer time, what else do you want to know?
Oh, I'm at your website now.
Okay.
And I love this, how you have just a picture of your like big happy family, like right there,
Yeah.
So, I love it. So,
Yeah.
And now what kind of, I did want to ask, so with working with, and now do you just work with pediatric clients, or are you working with adults as well?
No, I do work with adults as well. So what I really like to do is try to work on the family as a whole, because even though the kids are struggling, and once we get the kids healing, then we can focus on the family. Because what ended up happening to me was that I was so focused on everything that was going on with my daughter and trying to help and heal her, that I let myself go, crazy, and I didn't know what was happening to me. I ended up in metabolic chaos, like I became insulin resistant. My blood pressure was high. I was pre-diabetic. I, had every single thing wrong. Fatty liver. I gained like 60 pounds that I couldn't get rid of, and I couldn't figure out why. And so I started, using functional medicine on myself to run the labs and look at the tests and see what was happening, and bringing my own body inflammation down. My inflammation. I was in a constant state of like fight or flight the whole time my daughter was ill, and that has actually started to come down. My CRP level, which is, a blood level that we can do, it was supposed to be under 1, and mine was like 7.6. So I did some, my own testing on my, to see if I had any sensitivities, what was happening there. I ended up identifying quite a few food sensitivities. I had already removed gluten because I figured that if everybody else has a problem, I have a problem, but I ended up like removing dairy and certain things that I was eating all the time that were causing me problems. And so what I really want to focus on is the family as a whole, because once you're, when you get into that state where all you're thinking about is your family, and then you start falling apart, and then you don't know how to fix yourself afterwards. So I want to be supportive to the entire family.
Oh, I love that. And that is something else that is missing, especially with the moms. And I know that like pretty much every woman listening right now is like, yep, because it's just that female instinct to take care of everyone else. And I've seen this happen where there's someone in the family that's suffering, and then the person who is the primary caregiver then starts having health issues because then their health is getting neglected, and I've done similar things when I have worked with, say, couples before, if you have someone in the home that's working to heal, you can't have that one person eating this like really healthy diet and doing all these things where their spouse is like eating a piece of pizza and having a milkshake right in front of them, so it really needs to be like whole family wellness. And so now with your practice, so I know that you're doing all of like the lifestyle and wellness coaching and things like that. And what are some of the tests, like the functional medicine tests that you frequently run?
So for the kids, what I frequently run is I do a food sensitivity test because I feel like that's, driving so many of these problems, food sensitivities. We also do like a GI map to look at the stool. I've had a lot of clients that'll come to me and say, oh, my doctor already did a stool test, but your doctor didn't look at all the things we're looking at in a GI map. We got my daughter's first GI map back, we found out she had H. pylori. Well, H. pylori grows in your system naturally, but when it overruns and you start to have symptoms, now you have to do something about it. So because my daughter had so many allergies to gluten and corn and all that stuff, we have to have things that are compounded. It's very hard for us to get compounded antibiotics. So I had to learn how to treat these things naturally, to get them under control because she couldn't use antibiotics. I think there's like one antibiotic that she can actually have out of everything. When we have to resort to an antibiotic, we try, and then we do, I sometimes, if they're having issues with sleeping and stuff, we will look at like a metabolic wellness panel, and it looks at cortisol and like you were talking about melatonin and everything. And, a crazy thing that I found out when I had when I did my own test that way, my cortisol level was like 4 times what it's supposed to be when I first woke up in the morning. But then it dropped all the way down and I had no energy for the rest of the day. And then at 12 o'clock in the afternoon, since my cortisol was so low, it was calling in my melatonin to say, hey, come and help me. So at noon, my melatonin's 3 times that high, that it's supposed to be. And, and I believe this all developed because my body was in so much chaos, having to deal with everything that was going on. So I try to run tests, like that to check and see if that's, normal. We do, for moms, I do do a Dutch, if they need, if we're having issues with hormones and things like that. I have all kinds of tests that we do. And I do, depending on the child, do different food sensitivity tests. I like the MRT, which is like a blood test that you do, but you do have to go have it drawn by somebody. And if it is a little kid, sometimes it's easier to do the one where you just, stick your finger and do it on the paper. But nice thing about functional wellness tests, most of them can be shipped right to your home. You can do them yourself, just ship them back. The results come in and then we get together and go over them. And then we develop a plan together of how we're going to get you feeling better.
And I this is one thing I love so much about functional medicine and being able to work with a qualified professional is I do think when people are exhibiting signs and symptoms and things like that, you go to the regular doctor and there's not even any curiosity around why is this happening. And then when you are unfortunately, when we're using our health insurance, it really limits what kind of testing we can have access to. And there's so many of these functional medicine tests that are actually affordable. And when you look at just like your return on investment on things like this, when people are like really suffering and you may need to invest a little bit into your health, but if it helps you resolve chronic issues, I mean, oh my goodness, like you can't it's absolutely amazing. And I remember, when I started working as a functional nurse in my own practice, I was so used to being in the system, and every time you see your patients, they are worse and it is frustrating. But then when you actually start working with people on the outside of the system and you're on the holistic side, and then every time you see them, they're a little bit better. It is just like the most fulfilling work, Well, I really am like truly so excited about all of the good things that you are going to do. And I think that you're going to help so many families alleviate suffering because, I hear stories all the time about the frustration and then I hear about unfortunately, what some not so compassionate providers are telling these families. And so I'm glad that you have a heart for this work. And if someone wants to work with you, so how would they go about getting in contact with you?
So they can visit my website at www.daniellefriend.com, and you can book a free parent chaos to calm wellness call. And we could do it that way. You can find me on Instagram. I'm at Danielle Friend _wellness. Or you can find me on my personal page, because I leave that open to everybody too, at Danielle Lanessa. And then I'm also on Facebook. So, but I would like to throw in one more thing before we wrap up, because I feel like it's really important, because you really started talking about insurance and stuff. So what I want parents to know is that when you go to the doctor for traditional testing and evaluation, that the doctor is looking for a disease process and a diagnosis. So by the time that they get to that problem, your child may have been suffering for years or a long time before that it's considered a problem by the doctor. But functional wellness testing doesn't look at what's wrong with the child. It looks at why is this happening, and how can we make it better. So, and you did say that it was an investment. You're investing in health. So I think just changing the way people think of health and insurance and stuff is that we don't want to fix a disease that you've already developed and it is full blown. We want to get you before it's while it's still preventative, and we can make it better. Does that make sense?
Yeah, yeah. Well, and this is another, so frustrating thing about conventional medicine is they just, wait and see approach. Let's just wait until it breaks, okay? And
Right.
then we're going to go in and just medically manage you. I mean, this is what happened with my thyroid, and I really believe this is why I now have to be on thyroid medication because for years they were like, "Oh, your thyroid's a little off." They never did anything else, and they were like, "We're just gonna, wait and see," And it's silly when you think about these things. But I also like to let people know because there's so much lack of informed consent. When you're seeing a provider, in the system, people are not being provided the information and the education about these other options that may be available to them, So a lot of times people don't know when the doctor is like, "Well, I did your labs and your labs look good, must be in your head." They're not telling them that there are other labs available, like the Dutch test, which is a dried urinary test for comprehensive hormones, which we know is clinically validated. I mean, there's more advanced testing out there, but it just may not be accessible in that insurance model. Well, yeah, I mean, like I need to do another show on insurance companies and all the things they do that aren't good. But anyway, it was so great to have you here today. And
Thank you.
Thank you for tuning in to the Functional Nurse Academy graduate feature. If this conversation inspired you, don't forget to subscribe, leave a review, and share it with a fellow nurse who may be ready to level up in their career. If you want to be our next success story, feel free to visit functionalnurseacademy.com. If you are not a nurse, if you're in another healthcare specialty, I can train you as well. So go to christianfma.com for that training program. And until next time, be safe, be well, and God bless.
This was brought to you by Functional Nurse Academy. For more information, please visit functionalnurseacademy.com.